So let's deal with this big issue that really is at the heart of adaptive leadership. This idea of identifying adaptive challenges and distinguishing them from the technical problems that are faced by OHTs and other groups. Both are important, but the role of leaders is different in these two settings. Technical problems are those things that are well defined with solutions that are already known. And so those who are experts, when they have the organizational capacity to deal with these problems, can do this in a fairly straightforward fashion. Not always easy and not always cheap, but the technical problems are amenable to known solutions. Adaptive challenges are really quite different and really require a different approach from leaders. These are complex problems that are often not well defined ahead of the time. We don't know the full dimensions of these problems. Solutions are not always known in advance and require innovative and collaborative ideas among the people who are involved in trying to solve this. And even when those solutions are identified, there's often no individual or no single organization or entity that has the authority to impose them on others. And stakeholders must agree on these solutions and guide implementation, often having to change their attitudes, their priorities, their behaviors. So adaptive challenges are challenges for leaders, and they're challenges for organizations that they lead moving forward. But this is the path forward for these kinds of complex issues. Heifetz says this very clearly, and I think it's one of the values of understanding his approach is that if you don't identify which are the adaptive elements and which are the technical elements and deal with them separately, then you're going to be in big trouble trying to make these changes. And not surprising, but many leaders who come to their leadership positions because they're experts in a particular area want to focus on the technical issues first, and therefore don't give adequate time to the adaptive challenges and the needs to shift practice, to shift relationships in order to deal with those kinds of things. So I'm going to turn this out over to Lindsay, Lindsay Johnston from the Grey Bruce Ontario Health Team. We had a chat earlier about adaptive problems facing Ontario health teams, and she had an example. Lindsay, I want to turn it over to you.
Thanks so much, Ross. Hi, everyone. I'm Lindsay Johnston, and I'm the Executive Director of the Grey Bruce Ontario Health Team. So the challenge I spoke to when we met last week was the challenge that many of us are being faced with right now that may seem technical at first, attaching 100% of residents within an OHT to primary care by 2029. And, we have data to tell us how many unattached patients there are, how many providers there are. And if we're looking at it from a technical perspective, there's an equation there, but really, it's a much more complex challenge that requires really a lot of adaptive leadership because of the requirements of, intense collaboration, changing the ways we think. Every OHT is going to be approaching this differently because they have a different environment that they're working with, different providers, different dynamics within their primary care networks, and so many things to consider, not to mention HHR, primary care recruitment, and, in our rural areas, for anyone who's familiar with Grey Bruce, one of the FSAs that we were asked to submit a proposal for, going from one point on the northern Bruce Peninsula to another point in Saugeen Shores or further south, that's over 100 kilometers in distance in a rural area. So there's a lot of complexity, and not to mention, again, all the diverse stakeholders, including the community, that have a lot of interest in this challenge. So